Welcome to our webinar on how to navigate COVID care and concerns. I'm Brian Miltenberg. I'm the principal of Aquabog Elementary School, and I'm very happy to be joining you here tonight.
Good evening. My name is Edie Reisenberg. I'm the nurse at the Pulaski Street School. And our presentation this evening, COVID care and concerns, will go over navigating COVID conversations with your child, a review of some prevention strategies, and what to do if you or your child are being asked to quarantine.
So we are almost 1 year into this pandemic, which is very hard to believe, but it's true. And if you chose to join us tonight, I imagine it's because you want to be able to have better, more productive conversations with your child about the pandemic, about what's going on in the world. And I imagine for some of you, you may be worried about how this is affecting your child or how it's affecting your relationship with your child or your child's relationships with others. So we've got a lot of good practical advice tonight to support you in that regard. And the first thing I want to share is the idea that no matter how challenging it can be to have these difficult conversations with your children, it's always better to have them than not. Because the worst possible thing is when hard things come up, just to not talk about them at all, because that space can potentially be filled with all kinds of worry, all kinds of negative thoughts that can affect your child negatively. So even if you try talking about this, for example, and to talk to your child about how this is affecting them and it doesn't go well, you can be comforted by the fact that it's still better than not having a conversation at all, because your child knows that you care about how this is affecting them and that you want to have an open dialogue. So the way you start a difficult conversation is going to be different for everyone. The best advice that we can give is to always let your child be the one to set the pace. You know your child better than anyone, and you can let them decide where it goes and how it goes. If your child doesn't respond or it doesn't go well the first time, don't give up. They may want to talk about it, but feel uncomfortable or need more time to formulate what's really on their mind or what they really want to ask you about. So let them know that you're here for them. Let time pass. You can bring it up again. And you can always just start with an open-ended question. And the next important piece is to really welcome their questions. Let them know it's okay to ask anything that's on their mind, because there are so many things that are going through children's minds in a difficult time like this. And you may not be able to answer everything. None of us have the answers for everything that's going on right now, but you want them to feel comfortable asking. If they leave the conversation feeling ashamed or regretting something that they said, it's less likely they'll be willing to have this conversation or other difficult conversations after this one in the future. Situations like this bring up so many new and uncomfortable feelings for kids, and whatever stage of childhood your child is going through, they may be having a lot of new and uncomfortable feelings anyway, even separate from the pandemic. So the next piece is thinking about age appropriateness. I have worked with students from kindergarten through 12th grade at different points in my career, and I know that obviously these conversations are going to be extremely different depending on not just your child's age, but their overall where they are in their development. But kids are resilient. They can often handle much more than we think they can, especially middle school and high school students. We think you really gain a lot by being really honest with them, being open with them, and being allowing of their maturity to shine through. With the younger kids, obviously you have to gauge, what's going to be best for that child in that moment. One of the things that's been really difficult for people of all ages to talk about or to handle is the idea of the uncertainty and the probability that we're all trying to decipher on a daily basis. We're bombarded with numbers and charts and graphs, and I put this graph here not because I expect you to be able to make sense of it, but just to give an example of how complex all of the numbers and math that are bombarding us every day are. And how difficult, especially for kids, that can be to make sense of. So, for example, many kids are aware of the fact that you can be an asymptomatic spreader of COVID-19. You can have it and give it to someone else without knowing it. And they know that sometimes if people don't wear a mask, it's more likely that they're going to spread it. But that doesn't mean that any time that a student's mask breaks, that all of a sudden they're going to get everyone in their class or everyone in their family sick. So we have to keep stressing to them that yes, bad things can happen, but there doesn't mean that they will happen. And that's what I mean when I talk about really understanding the probability here. We don't want our kids carrying around that fear and anxiety that at any minute they could be hurting someone else. It's important for kids to know that even among vulnerable populations, the rate of very serious infection and mortality is still very low, and among people their age group, it's virtually non-existent. So that doesn't mean that we don't want our kids to take it seriously, but just that we don't want them to be in a state of panic. So finally, being self-aware, being conscious of our own emotions while talking to our children, whether it's about this or anything else. Just because we're the adults doesn't mean that we have it all together, whether we're talking about the pandemic or any other serious topic. And that's okay. Our kids take their emotional cues from us always, whether they realize it or not, whether they want to or not. And our stress and our tension will become their stress and tension. On the opposite end, if we show calmness and open-mindedness, they tend to reflect that as well. So if we're not feeling calm, we can be honest with them about that. We can say how we're feeling. We can say that we might not even be ready to talk right now if we're being impacted in a serious way. Kids respect that. Kids respect being treated like young adults in that regard. So really, at the end of the day, it's all about keeping the door open to our children. Whether it's COVID or any other topic, we want our kids to be comfortable in bringing things up with us, having hard conversations with us, and asking us questions even if they're uncomfortable questions. When they don't see us as someone they can go to, they're going to go somewhere else, whether it's the internet or to their friends or to someone who we might not trust as much as ourselves. And we'd much rather be the source of comfort for them and the source of information for them and the place they go to when they're feeling unsure.
So what proactive steps can you take? Focus on your actions and behaviors that you do have control over. What precautions are you taking to protect your family? You can talk about mask wearing. There are cloth masks available. There are surgical masks and N95 masks. Good hand hygiene. You want to make sure that you talk about teach your kids good hand hygiene, that they need to use warm soapy water for a minimum of 20 seconds. Or you can also use alcohol-based hand sanitizers, which are 60% alcohol content in it, to clean your hands. Going out in public, you want to remind your kids to keep their 6 feet distancing from other people. Look around you. And social gatherings, you want to be mindful of social gatherings. People are getting fatigued from being isolated at home and not doing their normal social things that they normally have done in the past, whether it's parties, getting together with friends, play dates. So you just have to be careful of those things. Who can you trust? Signs first, emotion. People are susceptible to manipulation by sensationalized stories in the news and on social media. You have to be an educated consumer. Do your research. So you want to look at sites that are focused on public health and indicate their mission is to inform and protect the public. You click on an organization's information. Look for things that say about our organization, that can give you information about the organization and can help determine their credibility. And if they have any biases, avoid sites that promote or sell a product related to the information provided. Some examples for some reputable sites would be our state and local health department websites. They do have quite a bit of information up there. The CDC has a lot of information. The National Institute of Health, World Health Organization, the US FDA, Medline Plus, and other experts who use well-accepted scientific analysis and publish their results in reputable medical journals. When it happens, getting quarantined. If you're exposed to someone who does test positive for COVID, you will be asked to quarantine at home for 10 days and continue to monitor yourself for symptoms of COVID for a total of 14 days. You want to limit your contact with others in your household if you're being asked to quarantine. Now, if you get a call from a school that your child was in contact with someone and they have to quarantine, just your child would have to quarantine, not the entire family. But when a family member does get sick and test positive for COVID, the entire family will need to quarantine for 10 days. You will be able to break quarantine after 10 days, provided that you are fever-free for 24 hours and your symptoms are resolving. But you also wanted to continue to monitor yourself for up to 14 days. If any additional family members test positive for COVID at that time, then the quarantine period starts all over again. So it is important that any family member that is ill, that they kind of isolate themselves in one room, if possible. Getting tested, there are a number of locations in the community that are providing rapid COVID tests and the PCR test. You can contact your local doctor's offices. Some are offering them. There are walk-in clinics in Riverhead, and you can also contact the local health department, has different sites. If you're unsure, you can contact the nurse in your building. We do have a printout of some local sites that you can go get tested at. Stop the spread. What can you do to limit the spread of the virus to others in your household? As I mentioned earlier, you can have the ill family member isolate themselves as much as possible to one room, like a bedroom. Where that family member should wear a mask if they're going to be leaving their isolation room, to go to other areas of the house, to go to the bathroom, to go to the kitchen, to leave the house, to go for any medical appointments. They should put a mask on. Good hand hygiene for everyone involved in the house. If the ill family member is going to be leaving their bedroom, they should make sure that their hands are washed. They should use hand sanitizer before they leave. Anyone who is caring for the ill family member, they should make sure that they do good hand hygiene, that they're protecting themselves and wearing a mask, that they're limiting how much time that they're spending with the family member who is sick as much as possible. And avoiding touching your face.
And if your child should end up in a circumstance where either they do test positive or they do have to go on quarantine, while it may be physically or medically the safest thing, it can be emotionally and socially the hardest thing. So always know you can reach out to your child's teacher or to an administrator at your child's school with any difficulty you might be having, and they'll be able to help you locate some support for you while you're going through that. So thanks so much for being with us. Our email contact information is here should you want to get in touch with any further questions.